Good morning. I'd like to welcome everyone who is attending today's Rossmoor Emergency Preparedness Organization meeting. We are delighted to have Briana Taylor, who's the volunteer extraordinaire with Northern California Red Cross. Among her many titles, she's the regional disaster chair, so needless to say, she's a very busy woman these days. I want to remind folks, we have some residents who attend our meetings, and then later for EPO coordinators, their team members, EPO members, and residents want them to know that we have a YouTube channel and that this program will be up on our branded private YouTube channel so that you can, check it out again. So for future people who are coming in to the meeting through YouTube, if you need to get in touch with me, please go to our rossmoorepo.org site and click on the bottom, Fran Gibson. Email me with any concerns or questions you have. I want to welcome everybody to the meeting this morning. Our other presenters besides Briana are Colene, our immediate past president and the blood program lead for our 5 upcoming EPO-sponsored blood drives with Red Cross. We're delighted to do this. And in the age of COVID, it's absolutely essential that we who can give blood, give it as often as we can because the need is increasing, it's not decreasing. Dennis Bell is here with Public Safety. We're delighted to have Dennis. Dennis and Briana are the 2 volunteer folks here who are giving up their holiday for Rossmoor EPO, and so I deeply appreciate that. Christine Monson is our question meister. So those of you who have questions and you know to whom on the panel you'd like to direct them, please put them in the chat box and Christine will bring them up. We'll have 2 different question and answer periods. We will have a question and answer period for Dennis Bell after his presentation, and then of course for Briana after her presentation. We also have Dr. Paul Holland here and Patty. Dr. Paul is a blood donation medical expert, and so if there's some questions that come up that Briana and Colene cannot answer on requirements for blood donations, Paul will help answer those questions. So I want to welcome everybody and remind you that the mission of the Emergency Preparedness Organization here in Rossmoor is to help residents prepare for emergencies and disasters and to help organize our residents, our neighbors, when we have a shelter-in-place order that's been given by civil authorities. So I'm going to turn this over now to Harris. Harris is our amazing Zoom meister. He's a great herder of cats. I kid him. And with these programs, there are a lot of cats to herd. And he's going to give you the ground rules for the Zoom meeting, which will make your participation in this meeting more productive for you. Thank you, Harris.
Hey, thank you, Fran. We expect to have on the order of 100 people in the meeting today. And so, as I've mentioned to people who came in earlier, we've automatically muted everybody's microphones. And we ask you to keep your videos off so that only the microphones and the images of the presenters will be visible. You will still be able to participate by entering your any questions you have in the chat control at the bottom of your screen if you're on a computer. Generally, the chat questions go to all presenters, but if you want to direct it to a specific one, put that person's name at the beginning of the question. And Christine Monson will be watching those, consolidating them, and then directing the questions to the specific presenters at the appropriate time. This meeting is being recorded, and a copy of the video will be placed on our YouTube channel and cited on the EPO website. Okay, Fran.
All right. Thank you, Harris. I want to remind our members, Rossmoor EPO members, that Pat Hutchison with Mary Spear, our treasurer's help, has put a link on the homepage. If you have not paid your 2020 dues, we would appreciate that $5 payment. It helps Rossmoor EPO meet its vital and singular core mission. So please go to the homepage if you're not certain It's been a long time since we've been in a clubhouse, folks. So if you're not certain where dues were paid at the back table, if you're not certain, Mary is happy to check the records and she'll make sure to indicate whether you're up to date or not. Those dues, that money is going to go for membership software. So it's really important that we're all stay updated. I'd also like to correct an error that I made as your president. It's my bad. When we sent out a recent email blast on air quality index, how to measure the smoky air we're breathing here, I listed EPA's airnow.gov, which is a composite, usually reading of the last 24 hours. And one of my members gently reminded me of Purple Air, which I knew about. And Purple Air does sensors record real-time air quality. What I normally do, and I did this when I could in North Berkeley, I would take a composite of the two. So I hear through Dennis that Golden Ring Foundation is installing 2 new Purple Air sensors, which is great. So Rossmoor is going to be well covered. I want to apologize for that error, and when we send out the next email, I'll have this information in it so that you know. I'm sure most of you are aware we had 2 small earthquakes in San Leandro. We're dealing with COVID-19, red flag warnings, heat extremes. So it looks like the tridemic, I can now call it the tridemic. We could have a major earthquake here and really have a pancake disaster. So we need to stay tuned. Just to report to everybody, the Bay Area, the counties who are in the Bay Area of the COVID-19 crisis, our death counts are up. The 7-day average has gone up 100 deaths per day. We're beginning to see what I would call small green shoots of hope throughout the rest of the state. But Gavin Newsom and public health officials here warn us and alert us to stay alert. This is nothing to take lightly, and we're going into the fall, so everybody who can and should get a flu shot, so we're not overwhelming the medical care establishment who will be dealing with COVID. When we go inside and are living more inside than outside, the expectation is our caseload will go up. Let me give a quick presence report. We do have 5 upcoming EPO-sponsored Red Cross blood drives. Colene is our blood program leader. Those dates, and we'll have these in the newspaper, we'll have them on Channel 28. They're going to post these next week, those dates, but you will receive this again in an e-blast, October 2nd, January 6th, April 21st, July 30th, and October 8th. Obviously, the last 4 are in 2021. Sharon Meckenstock is our mental health director for EPO, and she has agreed to put together a list of local hotlines for mental and social well-being. I'm hearing from my neighbors, the residents in my entry, and I'm co-coordinator in my entry, that there's a lot of depression, a lot of anxiety. And I love what Sharon Meckenstock said. I think this is really helpful for EPO coordinators to remember, and let me quote her, not everyone is stitched together well when there's a disaster. I think that would be putting it mildly. Our FRS radio comms team, Christine Monson and Amal Molik. If you are an FRS radio operator, they need your email. So if you are networking with us on Saturdays, please send your email to EPOCOMS@gmail.com. This is National Preparedness Month, September, and EPO is partnered with Sept, and we're having weekly articles that'll be published in the news. The first one is coming this Wednesday, and then the second article the following week will be grab and go bags. So we'll try to do this every September. I think it's great to highlight, and as Gavin Newsom says, repetition is the mother of emergency preparedness work. So all of this, if folks know it, does not hurt to repeat it. And again, regarding the membership software, I've spoken in depth with 6 presidents of various clubs and organizations here, trying to get an idea of how they handle the woolly issue of membership management. And Rona Lashinsky, she's president of the Computer Club, has offered to attend our next board meeting and to walk us, the board members, through all our options. And I have graciously accepted her wonderful invitation. And then I just want to thank again intrepid Harris Greenberg for all you do, Harris, to keep us, to herd the cats and keep us together. Folks who don't realize he literally sits down and edits all of these programs, makes us look even better than we should sometimes, and makes us look good. And then it goes up on our website and our YouTube. So a big thanks to Harris. Thank you. And now, Dennis.
Good morning, everybody, and thanks for having me for the EPO meeting. And again, thank you for all you do to support Rossmoor, the community, and GRF as a whole. A few things to update you on. As you heard last week, the Tice Creek pool was closed by the county. They had allowed us to open, but with the rise in the COVID cases, the county determined that even with the retractable roof and the open sides, that the Tice Creek pool is an indoor pool and therefore required us to close the pool. We were just as disappointed as all the residents, but we have to do what's right and we have to follow the county orders. Tomorrow, on Tuesday, September 8th, and then on Thursday, September 10th, GRF is hosting Kaiser Permanente for a flu clinic at Gateway. It's open to Kaiser members and non-members. It'll be held between 9:30 and 4 both days. We asked, trying to minimize the number of people, that people with the last names beginning A through K come 9:30 to 12:30. Everybody else come in the afternoon from 12:30 to 4. The flu shot is being offered will also include the senior high dose vaccine. At the time of the vaccine, if you're over 65, Kaiser will offer you that high dose vaccination, so it will be offered tomorrow. Fran mentioned Purple Air. GRF is going to install 2 Purple Air sensors, one at Hillside, one at the event center. We've contacted Purple Air. They're about 8 weeks out for installation. The Purple Air sensors require power and Wi-Fi, but they'll be installed within the next 2 months. Had some questions about fires. There's been a couple of transformer fires due to the heat back in August. There was one fire up to the top of Stanley Dollar. The fire breaks, I talked to the fire captain, and the fire breaks actually stopped the fire from spreading one at the top of Stanley Dollar. I know people are very concerned about fires. I don't know if we're going to be, if we, Rossmoor, the county, will be in a red flag warning starting tomorrow. I'm checking that. If it is, we'll put out information about that. Just important for all of us to be vigilant. It's also important to know that Golden Rain Foundation and mutuals have done everything required by the county for fire mitigation, and in some cases have gone beyond what the county and what's required for fire mitigation. So we've done what we can to prepare for minimizing the spread of fires. I also heard on the news this morning there's a chance for public safety power shutoffs at PS coming the next for Tuesday and Wednesday. I attended a webinar with PG&E back in May, I guess, and they've done a lot of work to try and minimize the areas impacted by a PSPS, so it won't be quite as widespread. They've also done work to minimize the areas impacted and to minimize the amount of time. The PSPS last year was pretty much spared most of Rossmoor. There's a couple of pockets, maybe about 100 people lost power during that PSPS. So I'm just hoping that PG&E has done something to try and section off Rossmoor if there is a PSPS. It won't be as widespread on the systems anymore. I did receive a question. Actually, in the last few weeks, I've had a lot of questions and a lot of emails, phone calls about evacuations of Rossmoor. First, I need to explain that the Golden Rain Foundation does not have the authority to order or to manage an evacuation. Evacuations must be managed and ordered by the City of Walnut Creek through the police department in coordination with the Contra Costa County Fire Protection District and maybe even CAL FIRE. In fact, when we updated our emergency operations plan, the city would not sign off on the plan until we, GRF, removed all references to evacuations, controlling evacuations. GRF could assist the police department with evacuations as requested and directed by the police department. The city of Walnut Creek is responsible for having an evacuation plan for all areas of their city, including Rossmoor. While they don't have a written plan right now, the police department and the city administration has assured me they could effectively manage an evacuation. One thing we did learn during the update of the emergency operations plan for GRF is that a fire starting outside of Rossmoor is unlikely to spread over all of Rossmoor at one time. We use some sophisticated fire mapping software that uses real-time data, real-time satellite pictures of vegetation, etc. And we dropped fires around Rossmoor with excessive winds, excessive heat, very low humidity. And the closest we came to with a 6-hour burn with the fire starting outside of Rossmoor, unsuppressed, barely encroached into Rossmoor. While an evacuation of parts of Rossmoor may be necessary, the experts have said it's highly unlikely an entire evacuation of Rossmoor will be necessary. And the reality is the city cannot effectively evacuate all of Rossmoor at one time. Any part of Walnut Creek cannot be evacuated all at one time. The infrastructure can't take everybody leaving at one time. We can look at the hurricanes in Florida, back in Florida, and the first thing you see when they require evacuation is gridlock on the freeway. Infrastructure can't handle it. That's why the approach from Rossmoor would be a phased evacuation. We would evacuate, again, I'm talking to the experts that have talked to me about this, have said they could evacuate a portion of Rossmoor, get those people out in a phased evacuation, move people in groups out of Rossmoor to make sure we can get out. Because even if you could leave Rossmoor, you have choke points all the way out through Walnut Creek and downtown to the Olympic. But my caution to you is, be prepared. You need to be prepared for any disaster. If you're prepared for an earthquake, you're prepared for an evacuation. Just pay attention, be vigilant. If there is a red flag warning and you're very concerned about Rossmoor and the fact you may need to evacuate, leave before there's an evacuation order. You're free to go visit somebody. It's tough with COVID right now, but you're free to go somewhere, go stay in a hotel somewhere, get out of the area before the evacuations. Because what the experts have learned during the last fires, they encourage people, if they feel unsafe, to leave before an evacuation order is issued. But you also need to remember that when an order is issued, go ahead and leave, because it takes a lot of resources to try and direct people if they don't leave after an evacuation. My parents lived in Rossmoor for a number of years, and if they lived there now, I would not, as a son, be worried about them in Rossmoor having to evacuate. I think Rossmoor is a very safe place, and I want to assure residents that we've done everything we can to try and mitigate the spread of fire through Rossmoor. And I guess I'll take any questions if there are questions.
Hi, Dennis. Thank you. Thank you again for being here on your holiday. Excuse me. I was quiet too long, so I can't talk. I do have a couple questions for you. You did talk about the fact that GRF cannot be in control of an evacuation, but how will traffic work? You mentioned choke points. Is there any plan for evacuation during an emergency?
The city does not have a Rossmoor specific plan. The idea behind a phased evacuation is that you can get people moving and actually have them leave Rossmoor in just groups to make it an easy analogy, in groups to get them out of Rossmoor, which would then alleviate as many choke points as if you tried to evacuate all of Rossmoor at one time. But the city does not have a Rossmoor specific plan. However, again, I want to let you know that they have assured me that they could manage a phased evacuation of Rossmoor. If you look at evacuations, they are done in phases, and they're usually done first. You have a warning, be prepared to evacuate, and then an order. A lot of people have compared Rossmoor to Paradise. They're completely different places. Paradise was in the middle of a national forest. We are not. And what you saw in Paradise was not an evacuation. It was an escape from a fire. They had zones. They had practiced evacuations. That fire was on them and they were escaping. Evacuations are phased and done orderly.
Okay. Another question is, how can one find out what evacuation zone they're in or area zone that they're in?
Thanks. In the emergency operations plan update, our consultants created emergency management zones in Rossmoor. It breaks down Rossmoor into a number of locations based on streets and how to best control traffic. And really, an evacuation is the important part of evacuation is once people are out, not letting them back in. That's really the tough part about an evacuation. If you want to know what zone you are in, you can go to the website, look at the Rossmoor Emergency Operations Plan. The zones are in that emergency operations plans. I've discussed those zones with the fire department and with the city of Walnut Creek, and they both have said these make sense for the civil authorities to use in evacuation zones. It really is not important for residents to know what zone they're in. The importance of the zone is the city and the county can use that through the reverse 911 system, the county alert system, and they can actually draw those zones in their system and they can reverse 911 call. We call everybody within that zone and say, you need to leave. So, but the zones, again, we can't call them evacuation zones or emergency management zones, but the civil authorities have said it works for them.
Okay, thank you. Will the hillside lawn bowling area be available for an entry to gather in during an emergency?
Sure. I mean, wherever you can gather, that's good. I'm glad that people are planning. That's a really important part is where you can gather. You know, the closer you can gather to your residence in a safe location, the better. The less you have to travel to a meeting point, the better. So if you have something close to your entry, open space area in your entry, I'd suggest using that. But yeah, if there is a major disaster, people need to gather. All GRF outdoor resources will be open for use.
Okay, good. There's a couple of questions about, I believe, the traffic plan and evacuation and any potential drills that we're going to have. Does Securitas have a role in managing traffic during an evacuation or?
As I said, the Colene Foundation cannot do anything with evacuation. It's a city authority. It's a city has to do it. The city I talked to the lieutenant in charge of the Rossmoor sector, and the city and the police department was going to plan a small drill in Rossmoor just to kind of see how the emergency management zones may work for evacuation zones. Unfortunately, with COVID-19, the drills are off the table right now. The city also, their emergency manager quit at the beginning of the year, and now with COVID, they have been unable to recruit, and they may not recruit for that position due to budget cuts. They might right now, the assistant city manager is in charge of the emergency preparedness. If anyone has questions about evacuation drills and plans, they need to be directed to the city. I can't answer that from the city. All I can tell you, they've assured me that they are confident they can manage a phased evacuation. Securitas is an arm of GRF because they're a contractor. Securitas and GRF would assist the city with traffic control as requested and as directed. Yes, we would assist the city as needed.
Thanks, Dennis. One last question that I see is, can you give an update on the Terra Granada fire? I think it was Terra California fire yesterday.
Yeah, there was a fire, kitchen fire reported on I have to look up the street. Turned out it was smoke from an oven. There was no actual fire. It was just smoke, and fire department was there, was able to clear out the smoke. That brings up a good point. You know, I know everybody's concerned and very worried about the wildfires. The main threat is a kitchen fire and a home fire. And we've seen a number of those in Rossmoor, which is terrible. On the good side, we also seen that they haven't spread through Rossmoor, completely through Rossmoor. They've been pretty much limited to a couple of manors and in the worst case scenarios, a building. We have a world-class fire department in Contra Costa County Consolidated Fire Protection District. They're right outside the gate. They respond, even though resources for the firefighting industry are stretched. Consolidated Fire has, the county fire has ensured that they have enough personnel here to take care of the needs in the county and in Rossmoor.
Okay, a couple more questions for you. One is, who should people direct their questions to at the city regarding evacuations or drills or anything like that?
I would direct the questions to the city manager's office, as the assistant city manager is handling the risk management for the city right now.
Okay, and that can be found on the city webpage.
Yes, I'm sure there's an email for the city manager's office that you can email.
Okay, and the last question's from me. Barbecues. None of us want to use our ovens when it's so darn hot, but there's also a risk using barbecues. Do you have any tips that people should follow?
Don't use them when it's as hot. That's the main tip. I mean, I'm in the same boat. It's just hot here where I live as it is in Rossmoor, and I didn't barbecue. I ordered out. I got food to go and went and picked it up. You know, the GRF cannot establish rules for the mutuals regarding barbecues. That's really up to the mutual to establish the rules. I would just, when it's hot like this, don't do it. I mean, it's not, we each of us have a responsibility to ourselves and to our neighbors and to the community as a whole to do what we can do to prevent things from happening. You know, we had the big fire on Rossmoor Parkway started by a barbecue. And so I would say at this time, just don't use it till things cooled off, and then check with your mutual for the rules about that. Again, we all have a responsibility to ourselves, our neighbors, and our entire community to take steps to prevent things from happening.
Well, okay, that's a good answer. And that wraps up, I think, all the questions that I have for you. So help the economy, order out. The city will evacuate us. Find a good gathering place that's safe and away from buildings that you can use during an emergency. And don't use your barbecue. So thank you, Dennis, again. Really appreciate you being here on a holiday.
And thank you, Christine, for being a wonderful question meister. And Dennis, we may have, as time goes on, there may be more questions for you in the chat box.
I will be here for the whole meeting, friends. So
You are awesome on a holiday. Gosh. Colleen, I'd like to turn it over to you, please.
Fran, before we start the rest of the presentations, I think it'd be good to run our quick survey beforehand, before we get all the information, and then we'll survey again at the end after they've gotten all the information.
See, he does know how to herd cats. Excellent.
It's like the poll I previously prepared has disappeared, so I need to reconstruct it, if you'll give me a moment. Be right back.
Dennis, I got a question regarding, I think you could answer, regarding the, do you know if Kaiser, if this is a one and done flu shot clinic, or would there be more?
as far as I know right now, Kaiser has only scheduled the 2 dates this week, and that might be about it. After that, you'll have to go to Kaiser or a private provider for your flu shot.
And theoretically, you can get the high dose and the regular dose at our flu clinics here, correct?
Yes, Kaiser said that if you're over 65, they'll offer all people over 65 the high dose senior flu shot.
Excellent, excellent. I wanted to confirm that to be sure that we got that question for you up out of the chat box. Thank you. Colleen?
Yes, do you want me to go ahead?
I would go ahead and then he can throw that polling question in at any point in the process and we won't be holding people up. Okay?
Okay. All right, so I just want to also thank everybody for being here and Dennis for updating us. That was really good and informative. Thank you so much. And actually, when it's so hot, this is a very good thing to be doing, all of our preparation here. So in that, I would say all of you have heard of the Red Cross, of course. It is American, but it is also international. The work it does falls into 4 areas. And most are aware of the blood collection and the major work that it does in disaster relief that Briana is going to talk quite a bit about. But were you also aware that it does a great deal of aid to soldiers and victims of war, and also does a lot of community education and outreach? It's truly an amazing organization. It's going to be my pleasure to introduce Briana Taylor to you. Many of you have been here in the past years to hear Briana's talks about the several facets of the Red Cross. But first, I must say on Briana's list, she is a volunteer extraordinaire. And she is a volunteer like you are and like I am. But she always seems to take the next step. She, for the American Red Cross, is the following. She's the Regional Disaster Chair. She is the Emergency Management Regional Program Lead. She is the Bay Area County Leadership Council Chair also. But I also have to go on from there and say she's also very active in the Girl Scouts, and that's important to me because I was active in the Girl Scouts too. She's a wife and a mother, and she's also my mentor now that I'm working in Red Cross. And I thank her so very much. I couldn't do it otherwise. A quick pitch for the upcoming blood drives here in Rossmoor. Every 2 seconds, someone in the United States needs blood. 1 pint donation can potentially save 3 lives. The Red Cross provides about 40% of our nation's blood and blood components, all from generous volunteers, like those that are going to give blood and that have already signed up. In October 2nd, we have our first EPO. It's our second Rossmoor one, but our first EPO blood drive. And there are 34 slots available. 17 are already filled up. And we're really thanked very much. We need an additional 27 volunteers because we need 10 backup in case somebody on the day can't come. So a bit additional blood drives, Fran already talked about. It's going to be again January 6th, April, June, and October. We're trying to do them quarterly so we can do a continuing blood drive here in Rossmoor. And we also thank Dennis. Dennis has been very instrumental in helping in this. We thank the GRF for providing the rooms to assist in this. It's a very vital life-saving function. My email and telephone numbers are in the newspaper articles Fran will be sending out and the emails that she'll be sending out. So you will be able to sign up. And if you have any questions at all, my email and telephone number will be there. There was a, I'm going to preempt Christine here. There's a little thing on the chat that said, will they give you the COVID antibody test? And I don't know if you can see my phone or not. You can't. But anyway, okay, so you download the phone app when you go in. They'll tell you how. The phone app from on your phone. And then when you give blood, then they send back within, I got it within 3 days, the results of your last test. And again, you can't see it on there, but it says negative. So they do give that to you. Okay, now going back to Briana, who very earlier this year was busy in organizing trainings on putting up shelters and doing the other 3 leadership roles that she has. And then COVID came, and then after that, lightning came. And so thank you, Briana, for taking time from your busy schedule to educate us.
Okay, I am ready with the poll if you're ready to do that.
Great, Harris. That's great.
Okay. This is going to be just a couple of quick questions, and after you indicate your answers, make sure you click on the submit button, and then after a couple of minutes of gathering them, we'll read the answers to you. Okay, so you should be able to work on the polls now.
Would you consider you had
Actually, re-editing on the fly apparently is not my forte. I messed up the question, so we got a duplicate of the question about shelters and no question about blood donations. We'll table this for now and pick up the polling questions again after all the presentations are done. We can get some comparisons.
Go ahead, Briana,
Okay.
and welcome again.
Well, good morning, all of you, and thank you for being here and joining us this morning. I want to thank the EPO and, of course, Fran and Colene and Harris and Christine and Dr. Paul Holland for being here and assisting with this. You know, communities across the country really count on the American Red Cross for help every day. And supporting those communities is really at the heart of what we do. You know, even here today, our work never stops. Even during the coronavirus, we remain focused on delivering our life-saving mission every day. It just looks a little bit different now. And that's what I want to share with you today, those differences. And when I looked back over the years, this is actually the 5th year that I've been here talking to all of you. So I'm surprised you're not tired of hearing my voice yet, but I really appreciate the opportunity to be here. And one time I hope I get to come here and not talk about a disaster, but more fun things, like all the preparedness you're doing with EPO. So I'm proud of all of you that way. So what I figured we would do is we'd first start off talking a little bit about blood and just how we've done things differently because of the COVID environment. So as there's lots of people who need blood products every single day. And the chances are you probably have had some yourself, or you know people who have had to use those products. If you take a look at the list on the right, it gives you many reasons of why people need blood. And as Colleen said, every 2 seconds, someone in America needs blood. And to me, that's just a staggering statistic. And that relates into our need to collect about 13,000 blood donations every day to meet patient needs. 13,000 blood donations, not once a week or not every month, but every day to meet the demand. So blood drive partners and donors like you are critical to fill that daily need, because about 84% of the donations are collected at blood drives. And those blood drives are usually close to where people live or where they work. But of course, during this coronavirus period, where people work is often now at home, and many of the businesses are not open the way they used to be to sponsor blood drives. So also I wanted to mention that 99% of first-time donors become donors because of partners like Rossmoor introducing the need to the general public. As Colleen said, Red Cross provides 40% of the blood supplied throughout the country. Again, it's a lot. And throughout the pandemic, thousands of blood drives across the country were canceled due to the virus. Businesses closed, people working from home, resulting in hundreds of thousands of fewer blood donations. So ongoing blood cancellations and resuming surgical procedures has caused now an urgent need for blood. And so, again, we need to make sure that we are supplying the blood around the country. There is no limit to the end of the coronavirus in sight at the moment. So Red Cross needs your help in actually procuring those donations. We'll talk a little bit about blood donations, platelet, antibody testing, and Tim, I will answer your question. We'll talk about those for a moment. And let me just say here, my expertise is on the disaster side. We have a whole group that is in charge of the biomed side of Red Cross, and they are trained medical experts who do this, which is why I'm so pleased to have Dr. Holland on the call with us to answer those questions that I can't answer. So the other thing is it's really important to remember that blood is perishable and it can't be stockpiled. So we need to constantly collect blood from donors every day. So last June, the American Red Cross began testing blood and platelets and plasma donations for COVID-19 antibodies. They're going to continue doing this through January of 2021. The testing is really helpful to identify individuals who have a COVID-19 antibodies and may qualify to be convalescent plasma donors. It's been shown that convalescent plasma donors are a critical piece in helping during the coronavirus, people who have been infected with the virus. Antibody testing will continue to help provide donors insight into whether they've been exposed to this coronavirus, and will provide information about COVID-19 to public health organizations. Now, Colene also mentioned, and I'll also show you the app, but you'll be able to get results from those tests within 7 to 10 days. And the app is such an easy thing to use. So I'd like to just talk for a moment about, it's really important that if you aren't feeling well and you've signed up to make a blood donation, don't go. It's simple. You need to take care of yourself, and it's not safe to be around other people. The Red Cross does a lot of testing, and I'm going to start talking about how do we make it safe. One of the things that I really love about the Red Cross is they made a commitment when the coronavirus came out that their number one priority was the safety of their workforce and the safety of the people who come and use our services. And everything that they've done really reflects that, that commitment. So one of the things they changed in blood during blood drives is there are no walk-ins allowed. Whether it's a blood drive or one of our blood offices, there's one in Pleasant Hill. You can't just walk in any longer. It is by appointment only. And one of the reasons for that is they want to control the number of people coming in so we can practice social distancing. The other thing that they do immediately before you even come in is your temperature is checked. The staff checks their temperature before they come to work. They check it during the day. And everyone is checked as they come in the door. You'll see hand sanitizer everywhere during the donation process. And social distancing is followed from the time you enter into the refreshment area after you give blood. People are required to wear face masks or coverings, staff and donors alike. Now I know some people, they have a problem with face masks, and we will work with them on what they can do. But face masks are required. They routinely disinfect surfaces, equipment, and donor-touched areas. These are some of the similar things that we do in the shelters also, and we'll talk about that in a moment. But you'll notice that everything is wiped down between donors. And the wearing of gloves by the staff is done, and it's changed often, not even just between donors, it's changed during the whole process. And of course, they use a sterile collection set and an antiseptic scrub for every donation. So because of all of these safety measures, it also takes longer for someone to donate blood, not a long time, but we can't see as many people in a day because of social distancing. The chairs that people sit in are spaced with a larger amount between them. So again, the volume of blood we can collect is less every day than it used to be. So that's why it's even more critical to have blood drives. We have more staff to do all of this now. Many are volunteers. So doing this has really required a change in how Red Cross is looking at things. And here's the app. And the app, as I say, is so easy to use. Just go onto the App Store and download it. The first time I went and gave blood, I downloaded the app, and it saves so much time. There's rapid pass on it. You'll get all the information from when you donated blood, your blood type, the COVID testing results. Everything will be right on the app, and it just makes things so easy. It will even remind you when it's time to donate blood again. So please download it. It's very easy to do. And I know both Fran and Colleen mentioned those dates. And I think it's also really important, and Colleen mentioned it, and I'm going to say it again. One donation of blood can potentially save up to 3 lives. You want to do something, you want to make a difference, this is a very simple way that you can make a difference and you can save a life. It's really important. I cannot stress it enough. So the first one is October 2nd. And then, as Colleen said, there's one once a quarter through all of next year. Hopefully things will change next year and it'll be a little different doing it, but we'll see. We will keep doing it no matter what. No matter what happens, we will adapt and keep doing it. But we can't thank you enough for donating blood. And please also, tell your friends, tell your family members, please have them come in blood and donate blood also. Again, they need to sign up, they need to make an appointment. And if it fills up at Rossmoor, which I hope it does, you can go online or on the app and it will tell you where other blood donations are. So you can still give it, even if you couldn't do it at Rossmoor. And I would love to see it fill up. That would be great. So, okay, that's a little bit about blood. Now, let's change for a moment and take a look at what else has been going on. I'm sure you've all heard in the news about the lightning complex fires. We in Contra Costa happen to be the first of the lightning complex fires. I don't know if that's something to be proud of or not, but we responded immediately. On August 16th, there were multiple vegetation strikes in Contra Costa and around the whole area. It wasn't just in the Round Valley Regional Preserve area. I live over in Lafayette, and I was outside, not outside, but I was just standing outside of the door watching the lightning, and I saw one of those big strikes come right down into Moraga. It was just unbelievable to see it. I grew up in Chicago, so lightning is not a surprise for me. And it's kind of exciting, but this was not exciting because of all the damage that happened. And it was really interesting because as a Red Cross volunteer, as this kind of weather is happening, just like right now, you are immediately on alert. And we also make sure that we have volunteers that can respond if something should happen. So as the day progressed and things got a little crazier, and as the evening and the wind started to shift, we knew that something looked like something was going to happen. And so the evacuation orders were issued to residents along March Creek Road between Deer Valley and Round Valley, north of all Morgan Territory Road. They evacuated around 500 people. The county opened 2 temporary evacuation points. One was at the Brentwood Community Center in Brentwood, and the other was at the Clayton Library in Clayton. Initially, they chose the Safeway parking lot in Clayton, except it had no lights. So it wasn't the best place to go at 11, 12 o'clock at night. So during this, Red Cross was preparing a team to go out and respond. We ended up sending 2 groups of Red Cross volunteers, one to each temporary evacuation point, so that they could canteen and really kind of assess the situation and see just what was going to be needed. Was this a fire that was going to go on? Were people going to be able to go home in 24 hours? Or was this a situation where we would need to somehow shelter people? Well, given safety concerns in this COVID environment, our primary choice of sheltering is non-congregate sheltering. Now, non-congregate sheltering, it really is not new to us. Hotels are not new. During home fires, when people have nowhere to go, we put them up in hotels. We just don't do sheltering at a hotel. So we'll talk about that in a few moments. But around 2:30 in the morning, we found ourselves calling for hotel rooms for around 50 people. Well, as you can imagine, at 2:30 in the morning, 500 people evacuated. A lot of the hotel rooms were already gone. The other extenuating circumstance was that most of the people who were at these temporary evacuation points had pets with them. So we couldn't just send them to any hotel. They had to be pet-friendly hotels. So around 5:30 in the morning, we found 2 hotels that would take these poor people who had been evacuated in the middle of the night with their animals. And we sent them to the Crown Plaza in Concord and Homewood Suites in Pleasant Hill. Fortunately, they were able to get some rest. We sent staff at those hotels to be there the whole time that the evacuees were there. So we literally set up a shelter and addressed their needs. One had medical needs, oxygen needs that our health services took care of. We made sure that they had meals, that they were taken care of that way, answered questions, helped them get updates. It was Red Cross staffing that, and our government partner from EHSD, Employment Human Services, helped staff those non-congregate shelters. So we were there for 2 nights and 3 days until the evacuation order was lifted. This is what it looked like as the order was lifted, and they started to clear up the area so people could return home. It's not just when the fire is out, it's that there's a lot that has to be taken care of once the fire is out before people are allowed to go back home. So we kind of took a deep breath, but we're watching what else was going on. And before I go into that, I just want to share with you a little bit about what we have been doing to prepare for this fire season. So in order to make sure that the community can turn to the Red Cross after a disaster, because that's what we do, we had to create new protocol to help everyone feel safe in a sheltering environment. Now, the Red Cross follows CDC guidelines, and we work closely with our county health officials and all of our government partners. And as I said before, the safety of the workforce and the community we serve is our top priority. So together with our government partners, we decided that we needed to do an exercise to give our partners, our employment, health, human services partners, a chance to practice what we had trained them to do, and a chance for both Red Cross and our county partners, and it was also the city of Concord, a chance to actually practice how would you handle safety protocol during COVID-19. Of course, to do this exercise, we had to get it approved by the county health officer, who deemed this as an essential government function. So we know that, as I said, our preferred method of sheltering during COVID-19 is in non-congregate sheltering, in hotels. It might be in dormitories. It might be in campgrounds, any way where we can separate people so they're not all together in a congregate setting. But we also know that in a major disaster, where thousands of people are being evacuated, it may not be possible to immediately get them in hotels. So we may have to do congregate sheltering until we can get them in hotels. So that being said, we spent a lot of time national deciding how would we do this. So protocol came out, we shared it with our government partners, we talked about it. And in the beginning, everybody was so focused on COVID that really fire season was pretty far off at that time. And all of a sudden, when things started to quiet down a little, fire season started to crop up. And we said, okay, let's move ahead with this because it's not going to go away, nor is COVID-19. So we decided that we would do this exercise. And on June 25th, we, along with Office of Emergency Services, Employment Health Services, Public Health, the City of Concord, Medical Reserve Corps, Animal Services, CART, of course, Red Cross, and our Access and Functional Needs Group, all participated in planning the exercise. And we used staff and volunteers as our clients for the exercise. And I'll tell you, it was an amazing experience to do something like this. Everybody had masks on, and if you think getting people to follow social distancing is easy, it is not. And also the experience of everybody in setting up a cot was not easy. We'll talk about pre-screening because, as I said, just like we pre-screen going into a blood drive, we pre-screen before you even step foot in a shelter. We pre-screen, there are questions that we ask, and if somebody answers a certain way to the questions or they're not feeling well, they immediately go to an isolation area for further assessment by health services. Before we set up a shelter, though, we do talk with public health to make sure that they understand what we're doing and we understand what they want us to do. We've also asked public health to assist us. And at those temporary evacuation points, we do some of that pre-screening and try to figure out just if there's a reason why people need to be isolated, or if we can just put them into a hotel, or if we're going to need to open up a shelter. So that's just a little bit about some of the pre-work that we did, the pre-planning. Well, I can't tell you how happy I was that we did that, because from R1 fire, we then had 3 complexes of lightning fires and more. It wasn't just 3. And the first of those was the LNU complex. And let me just say before I talk about those, and I know you've heard a lot about them, so I'm not going to spend a long time on them. But so we started with our DR, which is disaster response. And we knew that as more fires were continuing, that this would roll up and all the fires would roll into that disaster response. And that disaster response became a regional disaster response. And my position in that disaster response, I headed I was the Assistant Director of External Relations. And in external relations, you have government liaisons under you. You have community partnerships that report to you. You have public affairs, and you also have fundraising that all report to you. And we also have an elected official network of usually it might be our executive directors who fulfill that task. And our own disaster program manager here from Contra Costa, Jennifer Lucas, was Assistant Director of Intelligence and Planning. So you had 2 of Contra Costa people sitting on the leadership of this disaster. And let me just say, we know that wildfires, and I've said this to you before, are totally chaotic and unpredictable when they happen. Even when we do that, when we roll into a regional response, we make sure that there is a response team here in Contra Costa to be available if something happens here. So Red Cross has a local response management team. We have a regional response management team, which I sit on, and we have a division, which is the Pacific Division response management team, which I also sit on. So we really look at how do we take care of locally and expand regionally. We also know that when something large happens like this, and in a COVID environment, that we are going to be pulling from volunteers first around the region. First, local volunteers step up like we did with the Deer Zone fire. And all of these other fires that started, it was the local volunteers who stepped up to begin the response. But I'll tell you, when you're doing this, after a couple days, you start to get very tired. So then we started to reach out to regional volunteers to step in. Regional volunteers stepped in, and after about 4 or 5 days, as things continued to scale up, and this became a very large, complicated response, we reached out beyond the division even for volunteers to come in. But it takes 4 or 5 days before that can happen, before we get them in. But pre-planning has been just critical in what we've done. So let's just start with the LNU fire very quickly. The LNU fire, I don't know where that is there. So that was made up of the Hennessy, the Wallbridge, the Myers, and other fires, which started in Napa, but affected Sonoma and Solano. Solano was just, it was devastating what happened in Solano. And like Dennis said, I cannot stress enough to you that if you don't feel safe, you leave. You don't wait for an evacuation order. You go. There was quite a bit of damage in Solano, actually in Vacaville. The fire was very intense and moved very quickly. And again, as you see that, you need to go. You don't wait for an order to go. So right now, that fire is 375,000 acres. It's now 91% contained, and there's close to 1,500 residences that were destroyed in that fire, and another 232 that were damaged. A huge number of destroyed homes. So while that's going on, we also have the SCU lightning complex fire. And the SCU lightning complex fire really began, this was the fire that we were a part of, and it began with us in the Marsh Creek area. So, and that included Contra Costa, Alameda, Santa Clara, and Stanislaus counties. And so the SCU stands for actually the Santa Clara unit of CAL FIRE. And the LNU was the Lake Napa unit for CAL FIRE responding. So there were approximately 20 fires in the SCU complex. And this is now the second largest fire in the history of California. And the LNU is the third largest fire in the history of California. The SCU is almost at 400,000 acres. The only one larger than that was the Mendocino Complex Fire, which was 2 years ago, which was up in Lake County. So in our Northern California region, we're lucky to have the top 3 fires in all of California history. So right now, I'm happy to say that it is 92%. And we're just getting the disaster assessment information. We don't have specific numbers yet, but it was much less homes that were impacted and more open space in this fire. So you can see how close, I mean, the expanse, the areas that these fire covered were just incredible. Here's a picture of it. the Lick Observatory and how close it was to that. So now let's go to the third complex, which is the CZU August lightning fire. And many of you may notice Highway 1 there in the ocean. Boy, look at that, those clouds. There were 5 main fires in this complex, and that included the Dolan fire at Big Sur. This complex went from San Mateo County to Santa Cruz County. And in one evening, there were 64,000 people evacuated. Now, it's a lot of people. It is now, the territory that it covered, the fire was 86,000 acres, and it's now 76% contained. But in those 86,000 acres, there were almost 1,000 homes destroyed. And there are still evacuation orders in effect there. Now, there were just 3 other little fires that we were also responding to. The Dolan fire, which is down by Big Sur, the Carmel fire, and the River fire. And both the Carmel and River fire are now 100% contained. And there was also the Woodward fire that broke out in Marin, which is now 93% contained. And the Dolan fire right now is only 40% contained. So again, some active fires still going on. And the evacuations just continued and continued. This was the evacuation from Solano County. And when, again, let me say, when Dennis says, if you don't feel safe, go, because otherwise you end up in a huge traffic jam trying to get out. And during this fire, Interstate 80 was closed. It ended up being closed in both directions because of the fire. So, and then here was the evening in Santa Cruz when 64,000 people were evacuated. So just a little situational awareness here. In these fires, it's over 1.5 million acres have burned. There were 8 fatalities. There were 3,100 structures destroyed. Now, structures doesn't mean just homes. Those can be outbuildings, barns, but we are looking at well over 2,000 homes destroyed in this fire. A huge amount. I heard today that the number of homes that were destroyed in Santa Cruz is greater than the earthquake that they had in the Loma Prieta and the damage down in Santa Cruz. This fire did more damage. So it's just incredible. And the containment ranges from 40 to 100% right now. And as I said, the second and third largest in the area. But I want to share with you a little bit of, this is the map. We get these situational briefings every day on our, what we call Red Cross View. And if you look at, it's the span of control and the size of this fire that we've never dealt with anything like this in the Bay Area before. I mean, we've had big fires, but not so many fires, and nothing that went from Lake County down to Big Sur. It's a huge area to cover and to serve. So because of span of control, we divided the area into 2 districts. And right now, we still have over 4,000 people that are evacuated that have not been able to go home. And no one has been able to come up with an accurate figure of how many people were totally evacuated during these fires. But at one point, I knew it was 177,000 people that had been evacuated. That's a lot of people to take care of, or a lot of people to find somewhere to go. Right now, we still have 2 shelters that are open in Santa Cruz County, and we're supporting 1 independent shelter. And in those 2 shelters, we have around 237 people still that are not able to go back home. Now, as I said to you, our preferred way of sheltering is non-congregate. So currently, we still have around 2,280 people in hotels, in hotel rooms. And that's spread out in this area in around 16 hotels. Now, Red Cross provides services in those hotels. And with our partners, supply meals for everybody in those hotels. We supply disaster mental health, health services, everything that people need as if they would get in a shelter. And we'll take a look at what that looks like in a moment. Just to give you an idea, we had around close to 400 volunteers and staff deployed to this disaster. The interesting thing was that 207 of those volunteers were virtual. I was virtual. And we had 175 on site working in taking care of people in the hotels, in the shelters, getting all the stuff that you need, logistics, all of those things that it takes to shelter people. So, and I had 18 assigned to myself in external relations. So it was a large operation. It was the first time we had ever done a virtual job headquarters, which was very interesting to do. We learned a lot I liked, a lot I didn't like. And our government liaisons who worked with the emergency operations centers, most of the EOCs, emergency operations centers, were virtual also, or they worked virtually. Only 3 of the 13 emergency operations centers that were open were in person. One was the state, and then there were 2 others. Now, I just want to add one other piece to this. During this same time, Hurricane Laura hit Louisiana, and we sheltered 18,000 people in 5 congregate shelters. And we had over 40 hotels across Louisiana with evacuees in them. So again, I have to say, I am always just astounded at how the Red Cross handles major incidents, disasters around the country at the same time. I just have to say that the volunteers are amazing people who believe in this mission, or they wouldn't be doing it. And the way Red Cross works to prepare for situations like this to happen. If we hadn't been doing all this work throughout the year, there's no way we would be able to respond like this in a COVID environment. So let's just take a little look at what this looks like. A picture says more than 1,000 words. So I wanted to share some pictures. And remember, there were several shelters set up, not just the 2 that we still have open. Santa Cruz decided that they would only set up shelters. They would not put people in hotels. Well, again, remember, the government is responsible for the care of their constituent, of their people. So Red Cross is only there to serve at the request of our government partners. So we were there to support Santa Cruz in the beginning until Santa Cruz decided they wanted to turn those shelters over to us. But, and again, many people, we were putting people in hotels, and then we'll talk about that in a moment. But so here's some views of the way we did pre-screening in a COVID environment. You can see everybody has their PPE, personal protective equipment on. Even a Red Cross volunteer coming in to work a shelter is screened. You're screened every time you come into the shelter, whether you were screened the first time you went in. And even when we did the exercise in June, there were a couple people who said, "Hey, I was just in there. Do you have to screen me again?" And they were either county staff or Red Cross volunteers who were complaining about being screened every time, and we said yes. So screening is something we do every time you come in and out of the shelter. Again, it's nice when we have public health there doing it with us, but we don't always have that luxury. But pre-screening, again, is to determine if you can come into the shelter or if you need to go into an isolation area. We will not open up a shelter without an isolation area for people who have tested positive for COVID, who have been around someone who has been exposed. around someone who has had COVID, is taking care of someone. As I said, there's a questionnaire that we go through with people. And then we take their temperature, and if there's any questions at all, or they're feeling sick, even once they're in the shelter, they immediately go to our disaster health services or to the isolation area. So again, just some pictures of what it looks like. So once people are screened, then we can bring them in to register them to be in our shelter. And registration, again, we are following safety protocol. We'll look at that again in a moment. But just some pictures of the various shelters and what it looks like. And if you notice, it's not just one table width between Red Cross and the person registering. 6 feet distance, that's the width of 2 tables across. So again, making sure that everyone is safe in doing this. And if you notice hand sanitizer everywhere, there's usually a place for pens that have been used, pens that have not been used, so that everything can be cleaned. Lysol wipes there, as you can see. You can see in the background, there's a lot of RVs there. And so this was one of the actual outdoor cabin check-ins at one of the shelters. We're out there staffing it all night long. 5 o'clock, 6 o'clock, you don't get to go home because people show up at different hours. Sometimes they've stayed with a friend and then the friend says, okay, or they stayed in a hotel and then they ran out of money and so they come to a shelter. This all changed though. We'll talk a little bit about that in a moment. Safety protocol, hand sanitizer everywhere. Mask required, 6 feet apart, please. Signage posted everywhere. And if you don't have pretty signs, you make your signs to make sure that everybody is following it. And we call it CDC, but instead of the CDC, for us, it's cover, distance, and clean. So we're always reminding everybody of CDC. So let's talk about congregate sheltering. Again, large buildings. What you see is large areas, signage. Let me just, the things that make it all worthwhile are when you see little kids like this who just, you know, are just happy no matter what. It makes your day. Signage on where to go, where food is. Food is, we do food differently in a COVID environment. And, you know, again, you still have to provide all the services that you do. I mean, but you do it differently. I mean, showers, making sure that there are enough toilets, making sure that there's enough for people with disabilities and access and functional needs. So all of these things are being taken care of. And if you've seen pictures of our shelters before, they don't look like this. Yeah, they have cots in them, but they're not spaced this far apart. So you can imagine that in a COVID environment where you might have been able to get 200 people in a shelter, now you're only able to get 60 or some people. In a shelter, it was usually 40 square feet per cot. Now it's 110. And in some areas, you'll see what one of the shelters in Santa Cruz did because of the number of people. There were also people, as I said, in RVs and in tents in the parking lots of these shelters, where we were also feeding and providing services. This is one of the shelters also in Santa Cruz where instead of cots and 110 feet between the two, they put up tents. The state provided them with tents for people to sleep in. So the people were sleeping in tents in that shelter. And again here, just, you know, again, the way shelters look during COVID, very different. Again, we have our medical cots for people who just, it's not possible for them to lie on one of those flat cots. So those were provided. And then of course there were pets, and we'll talk about pets in a minute. But I know Dennis wouldn't leave without his dogs. I wouldn't leave without my dog. And I'm sure the majority of you would not leave without your pets. Now, those pets may be all kinds of animals, not just cats and dogs. And even during all of this, life goes on. Here's a dad working with his daughter on her virtual schoolwork. You know, I mean, people are resilient. It's really amazing to see. People were outside, as I said. They camped outside. You can see their tent over there. People didn't want to come inside, which we totally understood, even though we worked to make things as safe as possible. It's very difficult in this environment because what Red Cross does is we're compassionate people. We give people a hug. You know, we put a hand on the shoulder, and in this environment, you can't do that. So we've had to learn, how do you show compassion in a very different way? And some of that is just listening. It's also very different because you can only see a certain amount of somebody's facial expression. So it was really challenging. Here's another shelter. You can see as many shelters as there are, they all look different. But the one thing that they're all doing is they're all wearing masks and they're all practicing social distancing. Now, shelters aren't prisons, so you have to provide areas where people can go outside. They're free to come and go. But again, you can see people aren't sitting right next to one another, a very different way of being. Okay, and of course, as we know, people are exhausted. So the reason for all those shelters, yes, it's a safe place. It's a place where people can rest. You can see those brown paper bags and water bottles right there. When they're done, they should be thrown away, and they weren't here. But we don't put people in settings where they can sit at tables and eat any longer. We bring meals to them. We also have to provide space where people can find out what's going on. And again, you can see how one couple is sitting together, but everyone else is spread out as they listen to updates on the fire. A dad with his daughter, people asking questions, wanting to know what's going on. Again, family members together, they don't have to social distance, but everyone else does. And when it's time to eat, we either bring the food to them, or we have a system where people are in line, we put the food down, we step back, they come pick it up, and then they leave with it. But mostly what we did was we brought food to people who were at their cots. They ate on their cots or at their chair. They also had a disposable bag that they could throw their garbage into, which we wanted them to do. Here we were handing out a meal. Again, if you notice, the Red Cross worker, it has gloves as she's doing all of this. We had snacks. Again, I mean, all the same things that we would do. The only thing is they're all individually packaged, and people can't go take them themselves. We ask them what they want. We put it down for them. It's that stay 6 feet apart. We put it down, we step back, they come up and get it, and they can take it. They can have as many as they want. It's just done differently. Again, a different way in another shelter, having the snacks out there. The shelter resident says what he wants. Okay, pets. So the only pets that are allowed in shelters are service animals. We say that again and again, and you didn't hear this from me. I did not say this, but I have not been in a shelter in the last 6 years of fires here in Northern California where pets weren't in our shelters. You just can't separate people. Now, the trick to that, though, is how do you treat everybody equally? Because some people are allergic to animals. Some people are very afraid of animals. So you have to treat everyone in a fair way. So how do you handle somebody who has a pet and make it equitable for everybody. Again, here's another one. So in some of the areas, I mean, animal services comes and helps. Now, animal services might be very busy. There's lots of animal groups out there that come and support us. They'll bring crates, they'll bring leashes, they'll set up areas for animals. So it looks like in this shelter that this is a shelter where they did, or a room or a gym where they did allow pets. Again, many of the reasons people stay outside or they stay in their RVs is so that they can have their pets. Owners are responsible for their pets. Their pets have to be with them at all times. They're responsible for cleaning up after their pets, whether it's a service animal or a pet. So here's a sweet little cat in a crate, again, being taken care of. I don't know how this happened, but this dog is not in his crate and they are there together. I just love this picture. And tell me, who's going to go separate them? I'm not. So there they are. And as long as they're not disturbing anybody, it's fine. Okay, so let's turn for a moment to non-congregate sheltering. These are the hotels. Now, in the very beginning, Red Cross was putting people in hotels. But the need became so great that the state Mass Care and Shelter Task Force stepped in, and the Department of General Services decided that they were better equipped to secure hotels than anyone else and get a better cost for hotels. So they had daily calls with all the counties and were working on getting people into non-congregate sheltering. So again, like I said, we supplied the wraparound services to up to a lot of these hotels, not all of them. And here is one of our volunteers bringing meals to a group. Here she is knocking at the door, providing food. Again, everybody has masks on, handing out the meals. Another woman bringing food. Actually, she was bringing some supplies. When I said pets, I meant all kinds of pets. And you can see this woman has her pet with her. And again, here's one of our volunteers bringing, now, again, in the majority of hotels, we bring the meals right to the room and leave them outside. The residents know when the food is coming, when it's mealtime. And at nighttime, at dinner time, we'll often bring breakfast food with them. It's really nice when a hotel that we're putting them in has a refrigerator or a microwave, but they don't always. Here again, delivering meals. Done a little differently in this hotel. You can see that all the meals are there. They will put them out. The person will come up, they'll take their food and then go back to their room with it. So, whatever is working in that particular hotel. And again, snacks. You can see this volunteer putting out those 3 bottles of water. She's going to step back and then the family will come up and get those waters. So, and then just answering questions and helping people. It's really creating a shelter in a hotel. So we really look for hotels where we can put a number of people, not just one family here, one family there. And here is in one of the areas where they're putting food packages together for people. Now, all of that stuff has to come from somewhere. So we had 2 warehouses opened up, and those warehouses, one was up in Napa and the other was down. Many of you probably can place you're driving along Highway 101 and there's a big red barn south of San Jose. It used to be antiques and a flea market. Well, the big red barn was one of our warehouses. And that's another one of our groups of volunteers that had to be in person. So here they are, working at the warehouse, setting everything up, making fire kits to distribute as people were allowed to return back into their communities. It's a lot of stuff you need to take care of a lot of people. It was a very large disaster. It was one of the larger disasters. I think one of the largest ones we've had here in California. Again, food that went to the shelters, food that went to the hotels. This is our own Contra Costa volunteer, Patty Nelson, who was in charge of supplies. And then we started to turn into the recovery mode. And recovery starts at different times in different areas as people are allowed to go home. And local assistance centers are set up by our government partners, and Red Cross is a participant at those. Again, you can see the screening, you can see hand sanitizer. At local assistance centers, FEMA will usually have a trailer set up at local assistance centers. You'll have insurance companies. You'll have often nonprofits like Catholic Charities will be there, Suchi, groups on how do you, there'll be legal services there. How do you get your license again? Just a wide array of services that people need to start to get their lives back together. Again, another local assistance center. As I said, there were about 7 local assistance centers set up. And as the local assistance centers are set up, we're also delivering supplies back into the community. Another local assistance center. They look different in every place they're set up. So as I said, then we were out in the community. Bringing supplies to people. We were also, this was our Latino engagement group, and particularly in the Santa Cruz, Pescadero, Salinas area, there was a huge population of farm workers that were affected by the fires. And those farm workers still had to go to work every day and work in that smoke. So, and generally, the migrant and some of the immigrant population are not always very trusting of Red Cross, to be totally blunt. And so what happens is that they're afraid to come into our shelters, and they're afraid to come to us, and they see us as a part of the government, which we're not. So what our community engagement teams do, and this is, as I said, the Latino engagement team, is they talk to nonprofits in those areas who work with those communities and partner with those nonprofits. And there was a fair down in Salinas that the United Farm Workers was putting on that we went to along with these other groups, and were able then to give N95 masks to the farm workers, water, give them food, information, and tell them that the shelters were a safe place to come to. So it really is not just taking care of people in the shelters, but it's finding those pockets of people who are out in the community, and particularly in a big disaster like this, who aren't being taken care of. So that outreach is incredibly important to do. This is one of those families who came and, ended up getting a lot of things that they needed from that fair in Salinas. So, and it was really interesting because of the way that this disaster unfolded, and doing things in having people stay in hotels, that people didn't see a lot of Red Cross presence out in the community in the very beginning. It's because we were working harder than we've in any other disasters, but it was really kind of behind the scenes where people didn't see it. So there were certain challenges and learnings that came from this. And some of those were just the sheer scale of this disaster. It was like nothing we had ever done before. And to be able to stand that up on our own until we could get help in here from around the country speaks a lot to, just like CAL FIRE pre-positions, CAL FIRE and Contra Costa Fire pre-position their resources, Red Cross does the same. We have containers and trailers that are spread out, Sacramento, Reno, that can be brought in, a trailer with 800 cots in it. Now, a trailer like that, I mean, those things are very expensive, but they're certainly needed. The span of control on this was so great that, again, just because of the amount of space that was covered, we really had to figure out how to do that. Doing it in a COVID environment, making sure that our workforce out there was safe. And our workforce, we were either putting them in staff shelters or in hotels, preferably hotels as long as they were available. But you can imagine with that number of people displaced, there weren't a lot of hotel rooms, which is very helpful when the state stepped in. Doing a virtual job headquarters. You know, it's one thing to be in an emergency operations center and walk around and hear what people are saying. You're the eyes and ears of passing on information. It's very different when you're sitting at home on your computer and you have to ask specific questions of people. It's not the same as being there. It's not the same as in a job headquarters. If there's an issue, I can just go over to mass care or logistics and get an answer. Virtually, I have to call a meeting and bring in the right people so we can resolve the issue. So again, it's very different. In some ways, it's really nice because I got to sleep in my own bed. My days were 12, 14, 16 hours. My feet and my ankles were swollen every day from sitting. And I mean, literally 2 screens open, my phone, and not being able to, there were days I didn't even get outside. And my husband, it was so funny. When I'm deployed, it's hard to call him because I'm so busy. And I don't think he ever understood until he saw here, the doors were closed. And I mean, thank goodness for him. I don't know if I would have ever gotten a coffee or had a meal if he didn't bring it to me at my desk. When you're deployed, they bring food in, so you don't have to think about it. But he took care of it that way. And I think it was an eye-opening experience for him about what really goes on. Other key takeaway is you need to educate partners ahead of time about what we do. Here in Contra Costa, I have to say, we are so fortunate to have the relationships that we have with our government partners, that we so easily have worked together, whether it was EHSD's, Office of Emergency Services, Public Health, and put that exercise on together. I mean, they were all of them were, there was not one person when we mentioned it that said, I don't know if we should do it. They were all totally in. And so that's critical. In Santa Cruz, it was a new emergency management team. They had never responded to a large disaster. So you can imagine some of the confusion that took place that way. So building the relationships with all of your partners, not just government partners, but animal groups, feeding partners is critical. And so in the pre-fire season, we were building those relationships. And that makes a response go much more smoothly when something happens. So those are just some of the key takeaways. And I do want to open it up for questions and just say that it is a long time before people will return home, many of them, if they even have a home to return to. And the healing process will take a long time for many, many, many people. And this can all seem incredibly overwhelming to all of us. Fran said the coronavirus, the impact of the coronavirus, the heat extremes, the wildfires, the hurricanes, all of these things, and the small earthquakes that happened the other day. I mean, it is overwhelming. And I don't know of anyone who isn't impacted by this. But the only thing that I know for sure is that together is how we'll get through it. And whether it's working as a Red Cross volunteer, Rossmoor doing blood drives, individual people donating blood, it takes all of us together, as I say, to get through it. So I am so grateful to all of you for letting me come again. And I hope this gives you just a flavor of what these fires have been like. And it's never forgetting why we do it. You know, it's to be there with people in their darkest hour. And you never know when it could be you, so, or me. So it's what keeps us all going. When I was relieved from the job, at first it was like, no, I'm not done. I don't want to go. There's still so much going on. They brought a new leadership crew in. And when I finished that evening, I went to lay on the couch with my husband and I immediately fell asleep. I had no idea how tired I was. And then that next day, all I wanted to do was get in my car and drive and go to the grocery store. You know, something that was like normal activity. But it's, you know, it's an honor to be there with people. And again, thank you for all you do here at Rossmoor. That's, again, it takes all of us together. So we can open it up for questions. I was not monitoring any of the chat.
Briana,
So, yes.
before
And
we
you
start
can
that,
stop sharing the screen now.
Yep.
Briana,
Yes.
I want to thank you for a marvelous presentation, and you exemplify the 90% of all Red Cross work in our country, probably internationally, I understand, is done by volunteers like you. You are amazing. And I want to thank your and Dennis's encouragement. What I tell my residents here on Terra Granada Drive is the best evacuation is one on your own terms, if possible.
You got it.
That's important to keep in mind. And Briana, the app, the blood donor app, has a wonderful thing in it we should emphasize. Is it not true that it has take a selfie possibility where when you're giving blood, you can take a selfie and then you can, you can put it on social media and encourage your friends and your family to give blood. We can spread the word that way. Yes.
Thank you, Fran.
And Dennis, may I ask a question, please, sir?
Yes. Please,
Yes.
please.
Hello again. Can you give us a little background, Dennis, on the memorandum of understanding that Golden Ring Foundation signed with Red Cross for a future shelter here in Rossmoor?
Yes, the Golden Ring Foundation has a current memorandum of understanding, MOU, with Red Cross, where GRF can authorize Red Cross to use facilities within Rossmoor for shelters. The MOU is not site specific or not facility specific. It's just general for the Golden Ring Foundation. In the event there's a disaster and Red Cross needs to open a facility, they can call GRF and GRF either can say yes or no. And if we say yes, then Red Cross will come in and open a shelter. It's important to know, though, if Red Cross opens a shelter in Rossmoor, it's open to the entire community. It's not just a Rossmoor shelter. So it'd be something we would work out with Red Cross and discuss details before we open it up. But yes, we have a current MOU with Red Cross. In fact, just before the pandemic lockdown, Briana, myself, and some others, Colene, did a walkthrough of the GRF facilities to look at the facilities to make sure they meet Red Cross's needs, and they did.
Excellent. Thank you. Christine, do we have any questions for Briana?
We do have some questions. We have a few questions about a blood donation, some about the disaster, questions about traffic, and then barbecue. So I'm going to take them in that order.
Okay.
So first of all, for Briana and Colene, the October 2nd donation blood drive, is it in the fireside room or the Gateway parking lot?
It's in the fireside room.
Okay. And then the app, the blood donor app, I just want to confirm, because I told someone this was it. It's called Blood Donor, and it has a little drop of blood, correct?
I'm going to bring mine up right now.
So yeah, people can get that at the App Store, whether it's Apple or Android, and it says Blood Donor, and it has a little red dot.
Yep.
And
Yes. And John has an Android and I have the Apple, and we both got it very easily.
Right there.
Good. Good. Now, there was a question about, do we need to mention our medications before our blood donation? Perhaps you could talk about Rapid Pass and how much time that saves if you fill it out at home, because you have to look up dates and all sorts of things. And I know when I do it from home, and it's, as it calls it, rapid.
Go ahead, Briana.
Yes, it makes, and yes, you do need to share all of that information. And they just take it right from the app. You don't have to give it to all of them when you get in there. It's like pre-screening. So that information is incredibly helpful. And it makes, I think the last time I went and donated blood, which I'm due to do again, I went in, they took my temperature, they took me into a room. They just asked me a couple of questions, and then I was ready to go give blood. I mean, that's how quick it was.
Briana,
didn't have to go through. Yeah,
Briana, you can come sign up here. We'll let you come here.
I was thinking about that.
Please
I
do.
was definitely.
We'll save a space.
Okay. Yeah, but it really is beneficial. And then all that information is there. You don't have to keep repeating it every time. You just need to update the information.
I would like to give, or have you give, or Paul give, the Power Red information, because that's really important. We have a couple of those slots left. Do you want to do it, Briana, or should Paul?
Brianna, go ahead, please.
Power Red, and I'm not a Power Red donor, so I haven't paid all that much attention to it. It's a certain blood type, and here, I'm going to have to.
I can say that.
Okay, go ahead.
Okay, it's number one, you have to have weight. Female have to be 5'5" and a minimum weight of 150 pounds, and the males have to be 5'1" and 130 pounds, and it's for O type blood. Paul, what are the blood
Yes.
types?
O positive and O negative would be the best ones for that.
Okay, and the thing is that your blood goes a whole lot further. It takes a little bit longer, and you have to have those bases for it, but that's really needed.
Okay, and what about apheresis donations?
That's right, you had that question.
Apheresis means you're taking extra plasma or platelets. It takes a little bit longer, but generally they don't do these on blood drives except by scheduled appointments, because you have to bring machines to do this on you.
Right.
Okay.
And when you go into the Red Cross office to do it, they have movies that you can watch while it's being done. They put a little screen right in front of you, and you can watch those movies. Our neighbor across the street does it all the time. He had a little grandson with leukemia, and so he felt it was really important to do this.
I'm an apheresis donor. I haven't done it since COVID, and I have the most common type of blood, A positive. So they really don't need my blood, but platelets, they are in high demand. So they really treat you like a queen or king if you do apheresis donation. So if you can, and it does take a good 3 hours for me to do that, and you can get through the movie, you can watch the news. It's really something you can do if you have a common blood type. You can do it more frequently than you can do a blood donation, because you recharge your platelets in 24 hours. Is that right, Doc?
Approximately, yes. What you take away.
The other thing that I wanted to mention is I was so impressed because a couple of days after I gave my blood, more like a couple of weeks actually, they sent me a little notification of actually who my blood went to.
Cool.
It was so moving. And then John, they just said, sent one to John after he gave blood, and his went to the Santa Clara Sutter Center down there. So, I mean, to know where your blood is actually going is just very moving.
And then we've just had a couple questions about what would disqualify one from giving either blood or blood products.
Okay, there's several reasons. Could be when you have to be in generally good health. If you have a cardiac condition, that would probably X you out. If you have an infection, you couldn't donate. And your history has to be clear of hepatitis, of using drugs, having sex with people recently who are potentially at risk, multiple partners. So those are the main things that we're looking for. We want healthy people who can spare a pint of blood, whose hemoglobin is well enough in the normal range that they won't miss a pint of blood.
And if you sign up for Rapid Pass, you can fill all that out and find out if you can't donate. So that's another reason to do it on the app ahead of time.
And you can always call Red Cross and talk to somebody in the biomed, on the biomed line, and talk to them if you have questions, and they will answer them.
Okay, so that's the questions that I have regarding blood donations. And now let's move on to disasters. And I just am so grateful for what you've done. Who pays for the hotels if people are moved into a hotel?
So in the very beginning, Red Cross was paying for the hotels that we were putting people into. And when I say Red Cross pays for that, it's the American public who actually pays for those hotels in their donations to Red Cross. Red Cross, the money that Red Cross receives is through donations. We're not a government organization. We don't receive funding that way. Now, at one point, the state stepped in and then took over those hotel rooms, Department of General Services, and the state was then paying for them. So you had people who we had in hotel rooms. They were transferred over to DGS. You had people who, now, all the people who were put in hotels were verified that they were in the evacuation zone. That was the responsibility of the county to do, or Red Cross to do in the very beginning. And when somebody would come to a temporary evacuation point and say they need somewhere to stay, that we would gather that information, submit it to the county. The county would verify that they were in the evacuation area, and then the county would submit that information to the state. And then the state would go ahead and make those arrangements. So that's how the process worked. At the very beginning, it's the first time we've ever done it this way. It was confusing. I'm not going to say it was the smoothest process, because it wasn't. And the counties were confused, but it all happened. You know, I think as we do after action reviews on all of this, we will work, you know, talk with the state. I mean, Red Cross is right there at the Mass Care Shelter Task Force with all of the state groups, Department of Social Services, DGS, Office of Emergency Services. So, you know, I think there'll be a lot of comments made on how to make this process easier. So, and hopefully one day COVID will go away. So, but right now it's the safest way to shelter people. So, and as I say, we've done it for a long time. When people, when there's a fire in their home, we put them in a hotel for a few days, you know, until they can make other arrangements. So following up with that,
where can one make donations to the Red Cross? Either money or supplies or time?
The money, time, go to redcross.org. And you can donate there. You can volunteer. There. Or if you have any questions, you can always contact me. We can, right now, we are looking at individual assistance, which is the amount of funding we give to people whose homes were destroyed or damaged. And the determination of that, not the only determination, because we would do it no matter whether we raised enough money during the disaster, we would still give individual assistance out no matter what. But if we get in enough donations, we can up that amount of money that we give, or we can do second rounds of individual assistance. And the way we're doing it this time is different than we've ever done it before. Again, because of COVID, people would come into a local assistance center and we would do all the paperwork with them, our caseworkers. But now it will be by phone call. I don't know how they're verifying it, but they are, because I'm not a caseworker. And they don't have to come in. It will be verified that their home was destroyed. We get the damage assessment from CAL FIRE, and then we actually send our DA damage assessment team out to verify CAL FIRE's statistics, because they don't always go house by house. And sometimes there are people that'll say, my house was destroyed, and it will be behind somebody else's. And, CAL FIRE won't have realized that there were two residences right there. So we go out and do hot shots and make sure that it's verified. And then the money is either put on like a credit card for them, or if they don't have a bank account that we can directly deposit into, we'll send the money to Walmart, and they go into a Walmart store and get cash. So we try to make it as easy and available to people as possible. So,
okay.
Does that answer that question?
Yeah,
okay.
Very well. Thank you. So I do have a few more questions. I know we're running up on time, but there were a lot of questions about evacuations. Dennis, Briana, both of you have said, if you're concerned, go. Well, in Rossmoor, people going to the store get in a traffic jam here in Rossmoor. So the questions come up, if people go, who will manage that traffic? Will it be Securitas? This is before the city gets involved. When people are concerned and they all get in their cars and drive at the same time and forget to stop at the stop signs. Who will manage that traffic before the city gets here? And then, okay, so Dennis, I think that's probably for you to answer.
Well, I don't think you're going to have everybody leave at one time because they feel unsafe. Again, that's before there's any kind of an evacuation order. I mean, with the weather the way it is, and if we have a red flag warning in Contra Costa County that impacts Rossmoor, if you're not feel safe with that, you leave. If there's a traffic accident or something that blocks the traffic, we'd handle it like we would any other. Again, overall traffic management in the evacuation order is responsibility of the police department. And again, GRF would assist. I don't see a group of mass people leaving because they feel unsafe. That's an individual choice. The thing is when the order comes, you have to leave.
Can I just ask everyone to make sure that they've got mute, because there's some talking mute. There's some talking going on that is making it really hard to hear Dennis. So Dennis, what you said is, if you're concerned, go ahead and leave. It's unlikely that would cause a traffic jam prior to an evacuation notice from the city. But if there is a traffic jam, will Securitas, this is before the city gets there, on a regular day, if a lot of people leave at once, would Securitas try to manage that traffic?
You know, if a lot of people decide to leave at once, there isn't much good in the traffic because it's going to back up at Rossmoor Parkway and Tice Valley, and that's outside of Rossmoor. We can only assist with, you know, temporary traffic issues within Rossmoor. So if everybody leaves at once, it's going to be a situation where PD is going to have to be involved to manage the traffic once people leave Rossmoor.
Okay. Then one person asked, Fran, if GRF doesn't come up with a traffic plan for evacuations, will EPO do that?
Not likely. Not likely. I wouldn't think so.
Again, I've said this several times already. It must be my computer that's making that funny noise. I'm sorry. I don't know what to do. It is GRF and or EPO cannot make a traffic plan for evacuation. The evacuation has to be planned by law according to the City of Walnut Creek and the Walnut Creek Police Department. Again, GRF was told, thou shalt not make reference to how you will evacuate people in your emergency operations plan.
Okay, I think that that covers that. The last question is, oh, Briana, do you want to say something?
I was going to say, one of the things that we really learned with the scale of this, there's a chain of command. And the chain of command is there for a reason. And whether it's the City of Walnut Creek who is issuing the evacuation order and managing it, it's about the chain of command. And I can't tell you how important that was in this disaster, because otherwise you have people doing this and that and everything. Nobody knows what anybody's doing, and it is total chaos. So, I mean, that was one of my takeaways from this, is that no, you don't go off and do something on your own that way. There is a chain of command.
Something I remember the fire marshal saying when he was here talking in Rossmoor is, if you do go off rogue on your own, we don't know where you are. And so it's much better to wait until you're told what to do and then go where you're told to go, because at that point, the powers that be know where you are. So that was a very good point that I remember from that. So the last question I think I have is, why, to Dennis, why is it riskier to barbecue when it's bloody hot outside?
Barbecues are hot places anyways. I mean, they're fire, they're hot, and when you up the ambient heat to well over 100, you've increased the heat of your barbecue. Flame ups are much more likely. I mean, charcoal barbecuing, again, it's spur of the air alert. There's no prohibitions for cooking fires during spur of the air alert. But you know what? We owe it to ourselves, our neighbors, and again, our community not to use those kind of devices that are going to further create unhealthy air. With charcoal barbecues, you run the risk of sparks, and with fires, the sparks will travel. With the propane barbecue, the extra heat can easily cause a flare-up. Additionally, in Rossmoor, most people have covered balconies. Heat rises and it gets trapped in there. They're not really well ventilated unless you have a wind, but then causes another problem. So you expose yourself to that heat accumulating within your entry and causing problems for you. The health advisors say stay out of the heat when it's hot. If you're barbecuing, you're outside in the excessive heat. By a barbecue with excessive heat, you're putting yourself at higher risk for heat stroke, heat exhaustion, and succumbing to the heat. So it's just best, again, for yourself, your neighbors, and the community as a large, get something to take out and go. Go to the Back 40 Texas restaurant and get a takeout order of barbecue, but please don't use your barbecue. It's better for you and everybody else.
Okay, so just to sum up, get the blood donor app, donate if you can, whether it's full blood or apheresis, follow the chain of command during a disaster or emergency, and order in and help the community when it's this hot, because they need us to help them, and we don't need another barbecue fire here in Rossmoor. So thank you very much for all of you. Briana, I do have to say, you made me almost cry at what you do.
Thank you. Yeah. Yeah.
Yeah. That-
Can I say something really quick about Back 40? We just got a sad notice that they've had to close down for the 14 days because somebody with coronavirus went in there, and so they're having to close for the couple of weeks.
Who is closing?
Back 40 barbecue.
Got it.
one of the favorite barbecues.
Now we're in a crisis.
Yeah, when it rains, it pours. So I wanted to again thank Briana and Dennis, the whole crew here. I think it was fantastic. Now I think we are ready for one more survey. Hopefully this will be the right one. Just a second. Let me make sure I got the right one up here. Yeah. Okay. Again, when we do this survey, people need to click the submit button after you make your choices. And then after a couple of minutes, I'll give you the statistics.
While you're doing that, Harris, let me thank Briana, and let me thank Colleen and Dennis and Paul and Christine and you for a wonderful program. It has been wonderful. Briana, Rossmoor EPO is historically proud to be one of your partners, community partners, and I can't think of a better emissary for Red Cross than you.
Thank you.
You epitomize the mission. You're going to make it proud too. So
Thank
thank you very much. And want to warn people that starting tomorrow morning, we have the devil winds picking up across Mount Diablo. So please stay tuned and be careful. And Harris, do you have the poll ready?
I do. I'm going to end the poll
Reminder
now.
for everybody to please sign up for the blood drive. Just the October 2nd one is on right now, but the others will be coming online once this one gets, I guess, more filled up.
Okay. So can you see the results of the poll there?
And can I say one thing? When you go to the blood drive, you need identification. Bring your driver's license.
Yes.
Mm-hmm. Yeah. Just to round this out, on the before poll, I only had the question about going to an emergency shelter. And on the before, that turned out to be 60% people would and 40% wouldn't. And as you see now, that's jumped up to almost everybody is comfortable going to the shelter, given all of the stuff that you presented, Briana. So I think the presentation was
It worked.
especially effective.
That's
So
great.
just one last time, how do you sign up for donating blood here in Rossmoor? Just as a reminder to folks.
Colleen?
Oh, redcrossblood.org, and then in the place where it says your zip code or that, just write Rossmoor, and it'll take you right to it, and it gives a big spreadsheet. You won't be able to access all the times because many of those times are already filled up, but if you can get in and fill out your name and information, and if you have any questions, Fran is going to put my number and name up and how to do it on the website, and I think Marcia is going to send out an email.
Yeah, I think one of the questions that came up was because on the Nixle announcement that came out this morning, it said the blood drive was going to be in the parking lot of Gateway and not Fireside Room.
What?
The Nixle this morning was about the flu shot, not the blood drive.
Ah, okay, that was the flu shot. Sorry,
Oh, okay.
my bad.
Well,
I reacted
that
too
being the case,
fast.
Watch Colleen panic.
do you think,
Sorry about that, Colleen.
would you send out a Nixle with our blood drive information on it?
Is GRF co-sponsoring this event?
Yes.
then yes, send me an email with the wording specific and I'll check with Kelly and then I can send something out.
Excellent.
Thank you.
I need a specific wording that you want.
That's great.
Any concerns about getting a flu shot and then donating? Should you do it in any particular order?
It shouldn't be a problem. It's a dead vaccine.
Good. Yeah, good reminder, Paul. Good reminder. Well, let's thank everybody for participating in a wonderful meeting today. It's been incredibly informative and I think helpful as we go forward. And I would like just to end with Fran Gibson, president of Rossmoor EPO's recipe for 2020 Rossmoor stew. It takes 3 cups of COVID, 2 cups of poor air quality, 1 cup of extreme temperature, 1 cup of earthquakes, 2 tablespoons of a flex alert, 1 cup of the ghastly devil winds coming off Mount Diablo, 2 cups of wildfires, and 1 cup of public safety power shutoffs. I think we're there, folks. Thank you so much. Thank you to everybody. It's been a marvelous presentation, and I particularly want to thank the Rossmoor EPO family for all the work you do in your neighborhoods and your entries in your streets to help keep our residents prepared for doing their responsibility of getting themselves prepared. No one else can do it but the individual household. Thank you again, and hang in there, folks. This too eventually will pass, I hope. Thank you so much.
Okay. And then the contact information for the different groups is on the screen here with the emails and the websites.
Thank you, Harris.